So, anti-suicide is also another very, common function of non-suicidal self-injury.
And how widespread is, I don't mean to interrupt you, but I'm curious about that, because how widespread is that information for clinicians and treatment specialists to know that? Because that seems like that's pretty important to have disseminated out there, the idea that it actually can help prevent the next step for somebody who is having suicide ideation. You've just keyed in on something that I'm nodding heavily so the listeners don't see that, but I've witnessed that, and I didn't really understand, but it certainly changes and shifts my perspective dramatically right now on that topic. And so is that a widespread piece of information that a lot of people practicing in therapy and in counseling with adolescents or adults actually know?
Probably not. I can't answer that question with any sort of empirical data. Mm-hmm. What I can say, is that, when we there's some data out there about what teachers know about non-suicidal self-injury. And, I would say based on that data, as well as many, many years of experience clinically with this, is that no, most people are not aware of the anti-suicide function of non-suicidal self-injury and the risk that's associated with kind of having a cold turkey approach to stopping self-injury. And that's one of the reasons I like to do podcasts like this, and I word out. It's one reason that I, as much as possible, try to talk to clinicians and parents and educators so that they understand that that number one, non-suicidal self-injury is not necessarily something we have to freak out about. It's not something we have to say, oh my gosh, this person cut their arm, let's get them hospitalized for suicide. We don't necessarily need to do that. It also is something that we don't want to just force somebody to stop. And there's a couple of reasons for that. So the obvious response for a parent is to say, stop that. Why are you doing that? If I see you do that again, you're going to be in big trouble, right? So that's a very common parental response. As a parent, I get that, right? But it's not effective. And again, it can lead to a worsening of their condition. It also can lead to the non-suicidal self-injury going underground. And what I mean by that is that the most common areas of non-suicidal self-injury are going to be, the limbs, the torso to a certain extent, places that are relatively visible, especially for a parent who often is going to be, around while their child might be changing and such, or in a bathing suit. If the child feels or the adolescent feels that they can no longer engage in non-suicidal self-injury, but they feel a strong need to do so to regulate their emotions or to prevent suicidal thoughts or urges, they then might go to areas that are much more dangerous, such as genital areas, other areas that they feel people aren't going to see more clearly. And so we don't want to drive the behavior underground in that sense. We want people who are engaging in non-suicidal self-injury to know that we understand, that we get it. We know why they're doing it. And, we don't want to shame them for it. We don't want them to feel like they need to hide it from us.